Hello, everyone.
Hello.
So should we wait for 1 minute or should we just start right on time?
Senator. I like it. It looks like we have good attendance, so
Okay, well, then let the games begin. So we'll convene our meeting for Healthcare Workforce Safety Working Group. This is the Safety Working Group convening meeting, which is based on legislation, Public Act 24-19, Section 6. I'm Senator Saud Anwar. I am currently serving as the co-chair for Public Health Committee from the Senate side, and also currently representing the third Senate district, which includes the towns of East Hartford, South Windsor, Ellington, and East Windsor. And I will ask my esteemed co-chair, Representative Kristen McCarthy-Vahey, to have some opening remarks.
good afternoon, everyone. Thank you, Senator Anwar. And for those who I don't know, it's a pleasure to meet you. I am Kristen McCarthy-Vahey. I co-chair the Public Health Committee with Senator Anwar. I serve as state representative for Fairfield and Bridgeport, and am very happy to see some familiar faces, and want to thank all of you for saying yes to help us deal with an issue that we know we made a start in the legislation. We know that we have more work to do. We're grateful that you're willing to help us come up with some additional solutions that will help us make sure that our healthcare workforce is safe when they are out in the field and caring for folks. Thank you, Senator Anwar.
Thank you. So it's going to be a busy group, but a very, very important issue, which I know everyone present in this conversation recognizes the value of what we are hoping to be able to achieve. Um, During this session, we were able to put in some important perspective, but thankfully they are now a law. That is to make sure that every healthcare worker has a protection in place. But we felt we needed to go one step further because we needed to have more recommendations going forward about some of the specific areas. And we'll go over them in a little bit. But and that's why I think we are coming together to make sure that we learn from the experience of each and every one brings to this virtual table. With that in mind, we will try to introduce everyone, and this is going to be interesting. So what I will do is I will name individuals based on where I see them on my different parts of the screen. So I will name you, and you can actually introduce yourselves, and then we can move forward, and I will name somebody else. And if I miss anyone, it's because the squares keep moving, and I get distracted. So with that, I see Sasa Harriet on the list and on the top. Sasa, welcome, and please introduce yourself.
Hi, everyone. My name is Sasa Harriet. I am the CEO of Harriet Home Health Services and Harriet Healthcare Academy here in Hartford. I am a nurse practitioner and very happy to be a part of this committee. Thank you.
Thank you. And then I see Kim Sanders.
Sorry about that. Hi, everybody. Kim Sandor. I'm the executive director of the Connecticut Nurses Association. I am a registered nurse and a family nurse practitioner with experience in acute care, veterans health, federally qualified health centers, public health, and early childhood. And happy to be here for all the nurses.
Thank you. Tyler Booth.
Hello, I'm Tyler Booth from Community Healthcare. We are an FQHC, a CCBHC, and we deliver services in-home, in the community, and in clinic for about 10,000 people every year. It's good to be here.
Thank you. Barbara Pierce.
Hi, I'm Barbara Pierce. I'm CEO of the Connecticut Hospice. Thank you.
Thank you. And I see Tracy Wodak.
Hi, everyone. My name is Tracy Wodach. I'm the president and CEO for the Connecticut Association for Healthcare at Home. I'm honored to serve on this important work group for several reasons. Most obvious, and one that we fully support, is the safety of our workforce. I'm happy to have all these stakeholders across the the table or around the screen, I should say, to come together to really make sure that we're moving forward to the future of efficient, safe, and doable home services. Thank you.
Thank you. And I see Honorable Auden Groggins. Your Honor, welcome.
Hi there. Thank you. My name is Auden Groggins. I thank you for including me in this group. I am a Superior Court judge and preside over the criminal docket here in the GA 22, which is the Milford Superior Court.
Thank you. Welcome. And I also see John Brady.
Hi, everybody. I'm John Brady. I'm the Executive Vice President of AFT Connecticut, and I'm a registered nurse and glad to be here.
Perfect. Thank you so much. And I see Karen Buckley.
I apologize for being late running from one meeting to another today.
Karen, we lost you for a second. Can you repeat?
I'll try again.
Yes.
Good afternoon. I'm Karen Buckley from the Connecticut Hospital Association.
Welcome. Thank you so much. Stephen Magro.
Hi, Stephen Magro, the Policy and Research Director for 1199, the New England Healthcare Employees Union. I'm very glad to be here. Many thanks.
Thank you. Thank you so much. Ron Cotta, welcome. We can't hear you, Ron. Your mic may have to be changed from an option. So we'll come back to you in a second. And Terry Henning.
Good afternoon. I'm Terry Henning. I'm Vice President of Government Affairs with Aviana Healthcare. We are a licensed home health agency providing continuous skilled nursing services in all counties in Connecticut, as well as 32 other states. Really happy to be here as well. Thank you.
Thank you. And we have Chris Pankratz.
Hi, I'm Chris Pankratz. I'm CEO and co-owner of Masters in Home Care. We're a locally owned, licensed and certified home healthcare agency, and we provide skilled medical services in the home predominantly for the older adult population.
Great. Thank you. Julianne Giard.
Good afternoon. I'm the section chief for community services at the Department of Mental Health and Addiction Services, or DEMS.
Welcome. And Rihanna Gingras.
Good afternoon, Rihanna Gingras. I work for the Department of Correction and I am the Director for Parole and Community Services.
Perfect. And Peter Kolakowski and Beverly Henry, if you guys want to introduce yourselves, you're keeping track of what we are doing.
Hi, my name is Peter Kolakowski. I'm the public health clerk.
Hi, I'm Beverly Henry. I'm the administrator for the Public Health Committee.
Thank you. And they are the ones who have sort of kept this whole thing together. It's a and we have about, this is just one committee out of multiple other committees. So they are very polite. They don't yell and scream at us for having so many committees with so many people, but they can keep it together. Thank you so much. Eric Smullen.
Yes, hi. Thank you, Senator Amwa. I'm Eric Smullen, the Senior Vice President for Hartford Healthcare, and I oversee Hartford Healthcare at Home, which is the largest non-for-profit certified home health agency spanning the state, as well as our hospice program, also home-based hospice. Also have a private pay division, which is relatively extensive. I'm also representing our other home-based businesses, Care in the Home from our physician's perspective at Hartford Healthcare, in addition to so many other care in the home directions that Hartford Healthcare is taking. So I really value being a part of this committee and being able to add that additional voice beyond specifically home care and home health. So thank you.
Thank you. And Barbara Cass.
Good afternoon, Senator Anwar. Good afternoon, Senator McCarthy-Vahey. I'm Barbara Cass. I am the Senior Advisor to the Commissioner for Long-Term Care from DPH. Thank you.
Perfect. Thank you. And Karen Enders.
Good afternoon. I'm Karen Enders. I'm Director of Connecticut Hospice Home Care Division, and thank you very much for allowing me to be a member of this team.
Thank you. We won't be able to do it without each and every one of you. And David Brothwell.
Good afternoon. I'm David Bothwell. I'm the legal counsel and the legislative liaison for the Connecticut Board of Pardons and Parole.
Okay. And Ron Cotta. Ron, let's try again.
I don't think it's working.
It's working.
Oh, perfect. Ron Cotta, I am Commissioner Kiros' Chief of Staff for the Connecticut Department of Correction. Happy to be here. Thank you, sir.
Thank you. And I'm just going to name a few more people that I think should be here if I missed them. Eric Smullen, I think we got you. Yeah, and I think we have Sarah Gadsby.
Good afternoon, Sarah Gadsby from River Valley Services, which is the local mental health authority under the Department of Mental Health and Addiction Services, serving Middlesex County, Lyme and Old Lyme. Happy to be here.
Thank you. And Deputy Chief Murphy, Benjamin Murphy. Okay, and Julian, we got I think, did I miss anybody? Yes, Jen, sorry.
That's okay. I got booted off for a minute. My name is Jen LeDuc. I'm the Director of Quality and Operations for Day Kimball Healthcare at Home here in the Quiet Corner.
Thank you. And Marcus, why Marcus?
Hi, my name is Marcus Yankowski. I'm from Rome Smith Kowalski.
Perfect. All right. Did I miss anybody? Carabina, yes.
Senator, there is, I think, someone on here who's iPhone 344. I'm not sure if they have the chance to introduce themselves.
Sure. And then let's get, I think Carabina, what's, yeah.
Hi, I'm Anna Carabin. I'm a social work supervisor from the Department of Social Services, and I oversee the quality management for 3 Medicaid programs.
Good. And iPhone.
Good afternoon, everyone. Good afternoon, Senator. Thank you. It's an honor to be here. I'm Sergeant Clark from the Willimantic Police Department. I'm the accreditation manager in 18 years and also born and raised in Willimantic.
Love it. Thank you so much. Thank you for being. Now I think we have covered everybody, right? Okay. Now will there be a quiz after this? So I'll just take the name and you can tell me what the person does. We have it all down. Trust me, you can ask me, I know it. So I think the next step is an important one, which is designation of co-chairs. The thought was we should have 2 co-chairs. I know the work that everybody has a say in this whole process. In order to try to coordinate things, we felt that would be worthy to have a co-chair, 2 co-chairs for this committee. I think we were brainstorming because many of you know each other and many of you have interacted with each other, but not everybody knows everyone. And then so that sort of adds a little bit of a complexity, but Representative Kristen McCarthy-Vahey and I were brainstorming earlier, and the role of the co-chairs is more convening, and we will be part of the picture too. But they will be hopefully experienced with what the challenges are. So we had 2 names that were there that we wanted to propose. Representative Kristen McCarthy-Vahey, you want to add some thoughts to that too?
No, thank you, Senator. The legislation does stipulate that you, the group, do make the final decision. And again, as Senator Anwar said, just for purposes of organization and representation too, we did speak with 2 of the members to ask if they'd be willing to put their names forward. We can probably let them speak for themselves at this point. But I think again, ultimately, you all make that final decision. They will help guide, convene, and facilitate the process and the conversation for us.
Anyone wants to come forward this time, you're welcome.
Sure, Senators Anwar and Representative Kristen McCarthy-Vahey, thank you very much. Again, my name is Tracy Wodach. I have been asked to consider the co-chair position, and I would be honored to do so. I have over 40 years nursing experience in a variety of settings, and home health, hospice have been my passion for most of my career. I have led the State Association, Connecticut Association for Healthcare at Home, as their president and CEO since 2019, and have been with the association since 2011. And prior to that, I was with what is now Hartford Healthcare at Home, VNA Healthcare, for 10 years. So significant experience in the home health arena, and several of our members are on this work group, which is key to making sure that the voices of those that are in the field are heard. And then the stakeholders around the screen, as I said before, I'm sorry. I am extremely interested in making sure that we have some substantive conversation about how we can move forward with some solutions beyond Public Act 2419 to make sure that we're all working together to provide the safest options for our staff that go into the community, as well as for those that we serve. Thank you.
Thank you so much. Thank you. And is there anyone else?
Yes.
Lhasa, go ahead.
Senator Anwar and the rest of the committee. I have over 25 years in healthcare. From my experience range from being a CNA, working here in Hartford, all the way up to being now a psychiatric mental health nurse practitioner. I own a home care agency in Hartford. We face many of the challenges that the other communities in this state face. I work in the community as a visiting nurse. I'm very much involved in running my agency and hearing from all staff across the board and other stakeholders and providers in the community. For the past 2 years, Harriet's been present at the LOB, speaking up on issues that's, not the traditional issues, making sure that not only staff members that go into the home and other providers are safe, but also that those in need of care receive it, so that we can prevent further complications while going into homes. I have a background as far as utilization review with value options. I've worked on teaching units in the community at Trinity, New England. And, just here as a voice during the pandemic, we were able to pivot and come up with solutions to ensure testing and vaccine services in communities that, oftentimes fall through the cracks, riddled with violence, where, many might not know how to or figure out solutions how to go into those communities. So I'm here, and I would be honored to serve as a co-chair for this committee. Thank you.
Thank you so much. Thank you, Ms. Harriet, and thank you, Ms. Wodach. Is there anyone else who is interested? The good news is that I know a lot of you, and literally anybody can serve in this capacity with all the experience that you bring in. But it's worthy to have somebody who just lives in that space literally 24/7 to be able to help draw upon their team members and then get an insight. So if I don't see any opposition, I would say that we do have two co-chairs.
I would second that nomination.
Okay, perfect. Thank you so much. And with that, all those in favor can stay aye, okay? And anyone against or perfect. Thank you so much. Thank you for your willingness to volunteer your time and get blamed if anything goes wrong. No, nothing will go wrong. We are here for you and with you. I think the next item on the agenda is working group scope of work. And that's based on the legislation itself. And I think some of the things have already been legislated. And I wanted to just mention the parts that are in the picture. One is the working group is to study staff safety issues affecting one, home health care and home health care aid agencies as well. So what is going to be the impact on the home health itself, what is being provided, and also the agencies, and also number two is the hospice organizations. And then we had to keep the hospice organizations separate in the conversation. We did not in the legislation put anything for the hospice organization. The reason was that background check and some of those things will take time. And because of your advocacy, we recognized and respected that for all the people who came and say, hey, we want our workforce to be safe, but we don't want to delay even a minute if somebody is suffering. And that was a very critical part. And that's why we had to put this into the working group to come up with a way to be able to manage this. We also recognize that at times this is one of the most emotional time for families, and the process and the experience can be quite traumatic for not only the families, but the ones who are providing care. So that's why it needs to be a separate conversation around this topic as well. So I think home health care, home health agencies, and hospice organizations are the three broad areas to make recommendations to the Public Health Committee, and then perhaps other committees that may become part of this conversation. Did I miss anything, Representative Christine McCarthy-Vahey, on these topics?
No, Senator, I would just add, just for source information, as you most likely all know and are aware, the working group comes from Senate Bill 1. This is Section 6 of the bill. And if you look directly at the language, you'll see that it's not overly prescriptive. In other words, as in some other cases with groups, there's an outline that's pretty specific. This gives you the latitude as the professionals who are in this space and those who are encountering the issues to really look and focus in the areas and the ways that you think are most important and helpful to guide the legislature and our departments going forward.
Thank you. And as we plan these meetings, I would just add that you are welcome to invite people to be able to serve as your witnesses for any of your experience and the aspect. For example, if they're patients or a nurse or any staff member or a social worker, a therapist who has had an experience that would be insightful, and through your connections, you're able to identify them, it would be very good to have that experience around the conversations. And anyone who has any recommendations, feel free to reach out to the two co-chairs, but also to the members of the public health administrative team, which is Peter Kolakowski, who's going to be the main point of contact for this group at this time. So, and I would also suggest because we've had this conversation, I had a meeting, and I think the Representative Christine McCarthy-Vahey has had a meeting with Ilara Caring. They are taking care of some of the most complex patients as well. And they're not a part of this committee, but they very much would have a lot of insight and experience of complex patients who are impacted by our legal system and also have some complex psychiatric issues. So they would be very much willing to come and speak and share their experience and the challenges associated with the entire process. So if you the group would be interested, that would be good. Anybody has any thoughts? I'll open this up for a conversation about the scope of the group, if this is a good time to have. Yes, Tracy.
Yeah, I think, thank you, Senator Anwar. I think one of the things that is really important for this group is to help everybody understand what we mean when we talk about home health, hospice, non-medical home care agency services. And I know Eric Smullen also talked about many other services that are happening in the home on a regular basis. Sasa talked about a lot of different services. I think it's important maybe, and I can hear from others, that we perhaps plan, I don't know how many meetings we're going to be having before we make our recommendations, but perhaps one of the earliest meetings, we might consider having kind of an introduction to the home and community-based services. So the people on the group understand the complexities and the variety of services that are offered in the community, because it's obviously not just home health that is at risk for safety concerns. So I don't know how everybody feels about that, but I think it would be good if we were able to put together some type of like a 101 to help everyone understand all that we do.
Tracy, I just want to reinforce, this is the passion that I had and why I really wanted to be a part of this work group, to make sure that although you know, we've had tragedy in the home care and hospital, you know, in the home care realm right now, care is transitioning to the home environments, and with that, this global awareness of the kind of care, I think our legislators will really appreciate that broader scope if we can make sure that we're specific to meet the demands of what we're being asked to do, but at the same time make sure that it stays broad enough that we don't leave a section of caregivers out, especially since that's the future, I believe, of how we'll actually transform care.
Thank you. This is very helpful. I think, Tracy, to your point, perhaps when the next meeting is set up, you can have a handout or update on trying to delineate what's what for clarification of the terminology for everyone who's not living in that space. And then I think the end result of this group is that on the 1st of January 2025, there's a written report that would be addressed to the Public Health Committee, and then if you have other recommendations that would be relevant to other committees, by all means, that would be the report that you'll be able to share. That allows the legislators in 2025 to hopefully implement some of your recommendations. So I think that's the product that we are hoping we should be able to look at. The other thing I wanted to, I think that's the report is going to be the part, and I believe you guys will have your process information and then the report, and the report would have recommendations towards the end. Go ahead, please, Karen.
Hi, I just wanted to note that as we kind of move forward as a group, I think it's really important for us to keep in mind, as Tracy said, the full continuum of care for patients, and kind of that the impact that our recommendations may have on that. We already have a limited home care availability and people waiting for care and delays in getting that care because of workforce issues. So, and that keeps patients sometimes in settings that they don't necessarily need to be in. And so one of the things that Tracy and others will remember from our things that we learned during COVID is that if there's any changes to one area of continuum of care, it impacts the whole continuum of care. And so I just, obviously we have very important things that we need to look at from worker safety, but just want to keep that in mind as we make these decisions, that there is kind of a throughput or continuum of care perspective that we need to keep in mind. And we just need to keep that in mind so that patients' needs are also met, if that makes sense.
Jen.
Hi, thank you very much. One thing that I'm really concerned with here in the quiet corner is we don't have a lot of the resources available that other more affluent areas of the state would have. And our population density is not significant, it's not big. We have very rural areas out here. We don't have really good cell service in a lot of the areas. And I think we are going to have a lot of challenges with technology working all the time. When we look at resources in terms of like response times for EMS and police, I'm concerned about that as well. Just to give an example, we had our building alarm go off and it took 3 hours for someone to respond to us here where we are located in Thompson. So I'm very concerned about that. And I'm very concerned about things being put into place that may not fit the community that we have here in the Quiet Corner. So I'm hoping to bring that perspective here. And I'm very sensitive to, the things that we need to do for our staff. But we have some unique challenges, I feel.
Looks like you're unmuted, so go ahead. Yeah, go ahead, Sasa, or Sasa, you go ahead and then represent McCarthy Vahey.
Thank you, Senator Anwar. Jen, I loved that perspective that you just pointed out. And I think just like how patient care is unique, whatever we recommend and the solutions that we come up with have to be specific to geographic locations, because whereas, being in Hartford, we might face one challenge of waiting, because there's so much going on. And in the same way, in a rural community, you might have to wait, so we wouldn't want to see one area that the challenge might be, whatever the unique challenges are. I would hope that we can do this based on geographic locations, what we might know about crime in those areas, or the high-risk populations in those areas, known and unknown. So I think that was a great idea, to make sure that it's not one blanket across the state.
Representative McCarthy.
Thank you, Senator Anwar. Senator Anwar, I realize my remarks kind of bleed between this item and the next agenda item. So with your permission, I may make them now, and then, that may move us into the next part of the agenda. But Senator Anwar mentioned again, back to the statute itself and looking at the bill language, that January 1st date. The language of the bill actually says that the group will terminate when the report is issued January 1st, or when the report is issued whenever is later. I'm not suggesting we should just say, oh, it's fine, let's have the report in May. But I am acknowledging that it's the end of September. It's taken us a bit to convene all of you. And again, with major thanks to Beverly and Peter, tremendous thanks to them. But that, just practically speaking, even as I'm listening to this conversation, which is incredibly helpful, if you all are, depending on the op tempo of the meeting, and we're going to have a conversation about that, but I just wanted to kind of acknowledge and point that out, and say that as we move into that conversation for people to think about.
All right, the next item, I think, is about the meeting schedule. And I think if we try to keep the meeting schedule, at least get the next 2 meetings in right now, that'll save a lot of phone calls and emails perhaps. And then you can start to invite individuals to those meetings. But I know things may not work out for 100% of the people, but if it can, that would help us out, and we can announce the next meeting and the date right now. And may I suggest perhaps we pick next week, same time, as a starting point, just to get the conversation started. Yes, I see thumbs up. A lot of
Would
thumbs
this
up.
be, you're talking about next Monday, the 30th at 2:30?
Correct.
And how long do you anticipate the meetings would go? I know you can't tell me exactly, but just for coverage in the courthouse.
I think minimum, because you probably may need 2 hours if you're gonna front load all the good work in the beginning. And then the agenda, we can probably coordinate with the co-chairs. Is that fair? 2:30 to 4:30? Okay, I see. All right, I love it. Okay, so this is gonna be for, and
Senator
yes, yes,
So
ma'am.
just a thought in terms of being able to do some prep in between. One thought might be to start with next Monday and then perhaps 2 weeks from then to give a little bit of time, rather than 2 weeks in a row. Is that workable?
I will be out of the country, Representative McCarthy Vahey, on September 14th. I'll be back the 16th, but I will be out from the 9th to the 14th, just so you know.
And I would acknowledge, certainly, no matter when we have these meetings, there will be people missing, which is why, there will be recorded. There will be recordings of the meetings so that folks can catch up if they choose, or certainly can contact us or the co-chairs to catch up. But I think that will just give a little bit of time to prep and think through the next steps after that initial meeting. So is there consensus on that thought, or Senator Anwar, back to you?
Yeah, so the 2 weeks are the 14th, that's Indigenous Peoples' Day or Columbus Day. So should we go to the Tuesday, the 15th? 2:30? I see, yes, okay. Good, no, okay, just one no. And fair amount of the co-chairs, I've lost my co-chairs. Yeah, there. Tracy, would that work for you, Sasa? Yes. Okay. So 2:30 on the 15th of October. Okay,
It's Monday or Tuesday?
Tuesday.
Tuesday.
Monday is a holiday, so we wanted to. And
Never
should we have
tell nurses that there's a holiday. Home care nurses don't have them.
That's right.
for us, it was probably. So then should we go another 2 weeks after that, Representative Kristen McCarthy Vahey?
Senator, I would suggest that the co-chairs really would have a bigger
Yeah.
voice in that.
Okay.
So Tracy and Sasha, I'd love to hear from you in terms of your thoughts with that.
I think Sasa and I may want to get together and think through next steps and who might, need to present at each meeting if we're looking for, information on certain topics. I do recommend, and hopefully Sasa agrees, that we set something regular on the calendar so that people block out that time. But I will tell you that Monday, the 28th of October, is the first anniversary of Joyce Grayson's death. So I will not be available that day. And we have some memorial things planned. So I think we probably just need to come up with something that will work.
Mm-hmm. I like the idea of something regular. I think by the time we turn around, it'll be January. Yeah.
And so I think the next item on the agenda is announcement of time and date for the next meeting, which we already have, which is going to be 2:30 on the 30th of September. And we'll organize that. And if there's nothing else, we'll go to the next item on the agenda, which is adjournment.
Senator Anwar, may I just ask one question before the adjournment?
Please, yeah, please.
Because I haven't co-chaired a state a work group yet, but with Peter being the admin for this group, does he do the minutes? Do Sasa and I prepare and send something to him? How does that work?
If I can answer that, I'll prepare the minutes and I'll review them with Bev and then we'll post them on the website. So you're good for that.
Great. Thank you very much.
We're going to try to help out as much as we can on the health side. Bev, you wanted to say something?
No, Senator.
All right. So I also want you guys to know that both Representative Kristen McCarthy-Vahey and I are here as well to help out. This is perhaps one of the most important bills that we had passed for making sure that our healthcare workers, who are the most important part of the healthcare team, in all levels are protected, and the ones in the home arena need to be protected. So this is an emotionally very important bill for us as well, but from a public health perspective it is. So we will be available to you. You're not alone. All right. Thank you. With that, we stand adjourned. No, sorry,
Senator,
wait.
as we're adjourning, I would ask if our new co-chairs would be willing to stay on with Senator Anwar and I and Beverly and Peter, just to have a little bit of a follow-up discussion for going forward, if you could.
That's
It helps to have a social worker watching over things.
And Beverly and Peter. Thank you all.
Thank you.
Thank you. Thank you, guys.
Thank you very much.